Health and education staff are among those who had to be let go because of the mandates.
And the District Health Board has lost close to 100 healthcare workers because of the vaccine mandate. More than 100 teachers have also lost their jobs.
Thousands of workers at businesses like bars, gyms and hairdressers will have to get the jab to keep their job under a vaccine mandate just announced by the government. Vaccination will be required for all workers at firms where customers need to show vaccine certificates, like hospitality and close contact businesses. There'll be a new law to make it clearer for employers to decide which types of jobs require a vaccine. Non-vaccinated workers in those roles will be given a new 4-week notice to get the jab or lose their job.
We're working to make it as clear and as simple as possible about when it is reasonable for an employer to require vaccination as a condition of employment. This law change will require a minimum of 4 weeks paid notice for any employee who loses their job because they are not vaccinated.
Cabinet has decided today that vaccinations will be mandated.
Once the notice period commences, the employee will have that amount of time to get vaccinated. The employee will be able to retain their employment if they get vaccinated in that period, but their employment will be terminated if they do not.
Government is planning to require every single teacher at every level and all support staff who work with children to be vaccinated.
News Hub can reveal the mandate Chris Hipkins is taking to Cabinet on Monday is a mighty big stick. Every educator who works with a child will have to be vaccinated.
I can now confirm that we'll be extending this requirement to large parts of our health and education workforces as well. Cabinet's agreed that high-risk workers in the health and disability sector will need to be fully vaccinated by the 1st of December. This includes general practitioners, pharmacists, community health nurses, midwives, paramedics and all healthcare workers in sites where vulnerable patients are treated, including intensive care units. We'll also be including certain non-regulated healthcare workforces, including aged residential care, home and community support services, kaupapa Māori health providers and non-government organisations that provide health services. Schools and early learning staff and the support people who work with them, who have contact with children and students, will need to be fully vaccinated by the 1st of January 2022. That includes home-based educators, all those who support people in our schools and early learning services such as teacher aides, administration and maintenance staff, and contractors. Secondary schools in Kura will also be required to keep a COVID-19 vaccination register of their students. Students that don't produce evidence of vaccination will be considered unvaccinated.
What will the ramifications be for teachers or those in the health workforce who choose not to be vaccinated?
Ultimately, in the health workforce, they will not be able to work in those roles. In the education workforce, from next year, they won't be able to work in those roles.
There was no compulsory vaccination. People made their own choices. There was no compulsory vaccination. People made their own choices.
Last week I announced that the education and the health and disability workforces will be required to be vaccinated to help prevent the spread of COVID-19. This follows on from the government's earlier decisions for workers in our MIQ facilities, our airports and our ports to be vaccinated. We can't leave anything to chance, and that's why we've made the very difficult decision to make the vaccinations for people undertaking those roles mandatory. Anyone conducting high-risk work in the health and disability sector to be fully vaccinated by the 1st of December 2021. Under these new requirements, GPs, pharmacists, community health nurses, midwives, paramedics, and all healthcare workers in sites where vulnerable patients are treated, including intensive care units, must receive their first dose of the vaccine by the 30th of October. These requirements also include certain non-regulated healthcare work, such as aged residential care, home and community support services, kaupapa Māori health providers, and non-government organisations who provide health services.
There was no compulsory vaccination. People made their own choices.
Has he been provided with advice from officials on the impact of the Yardley and Minister for Workplace Relations and Safety High Court decision on the legality of other vaccine mandates imposed by the government? If so, what does the advice say?
Mr Speaker, without getting into the specifics of the legal advice that has been provided to the government, it is important to note that the Yardley decision, when read in totality, was actually a very narrow decision and cannot be applied to other vaccination mandate decisions. Vaccination, the use of vaccination requirements for certain workforces is something that the government keeps under review. As I've previously indicated, it is possible that some workforces will find those requirements removed before others. Many of the workforces covered by the vaccination requirements, so for people to continue to do those jobs they needed to be vaccinated, are in the public sector.
There was no compulsory vaccination. People made their own choices.